How we doing, everyone? So we're in the middle of the desert here, obviously, and we're heading out towards LA, where I'll be getting my next elbow surgery. And I haven't really gone through my elbow problems before, but I have mentioned it a little bit. And if you guys follow the channel, you know I've been struggling with elbow issues for a long time. So it's been about 4.5 years actually since the initial injury. And I wanted to go ahead and take the time and walk you guys through the injury, really what happened, what the history of it, and why we're heading out here and what we're doing. Also, this will be the first video of a few videos, which will just be a series on the whole recovery process. So I'll just keep you guys along with me as we do stuff. So when we're going to surgery, obviously, when I get the surgery, obviously you won't be in the room with me, but immediately after, when we go through PT, when we go through throwing, hopefully back into playing, any ups or downs or whatever, I'll take you guys along with me. So, like I said before with my elbow, it's been about 4.5 years, and the initial injury happened at the end of 2016. So it was after my first professional season. I was long tossing, and I made a throw at a really high intensity, and this was after on-ramping, and I made a throw, and it felt like my elbow just kept extending. So I didn't feel anything on the inside of the elbow. It felt like it just kind of pinched in the outside, and like it kept extending. So went ahead and like deloaded a little bit just to make sure everything was good, and tried to get back into throwing, and it was not good. So I realized I had actually hurt myself, and I wasn't quite sure what was wrong yet. So went ahead and got in touch with the D-backs, which was the team that I was with at the time, and they went ahead and had me report to spring training early so they could put me into PT and take a look. So we got an MRI, and they said it was a torn UCL, but it really wasn't that bad. So they were pretty confident that I'd be able to rehab it. They said that, you know, they've seen plenty of guys with much worse UCL tears do totally fine. So we made the decision to rehab it. Now, about 3 months into the rehab with the D-backs, I hadn't progressed at all. So I was still having quite a bit of pain throwing. I mean, I couldn't get above like 72, 73 or so without discomfort. I mean, I could throw harder, but it would hurt, obviously. So we went back in for another MRI. They said nothing has changed. UCL is still very slightly torn. And they recommended that we do some sort of surgical option. So I wasn't quite sold on Tommy John yet, or doing anything really extensive. So I asked about, well, what about a PRP shot or a stem cell injection with the goal of just like stimulating healing around the UCL? They said that was a great idea, and let's go for it. So we went ahead and decided on a stem cell injection. I was actually released about a week after we decided on the stem cell injection. So at this point I'm on my own. And I got the stem cell injection, rehabbed for like 5 months or so, and got back into throwing, and I could tell it still wasn't right. So I then realized, okay, we got to do something a little more serious. And went and started talking to the doctors with the Andrews group in Alabama. Jeff Dugas was the doctor out there, very well-known and famous elbow doctor. And we started talking, and I had 2 potential procedure options. One was Tommy John, where they'll take out the UCL completely, and they'll put a new ligament or something else in its place. And the second one was called a UCL Repair, where they keep my same ligament as long as it's healthy, and then they attach a kind of like a brace in there as well. And they just drill in the old ligament and keep a brace in there. So basically, what we decided on was, while I'm in surgery, they're going to determine how like strong and healthy the UCL is, because you can kind of see it with the MRI, but once you're in there, it tells you a little bit of a different story. So I told the doc, or he told me, that he would make the decision when he was in there whether we were going to go with UCL Repair, which is a shorter recovery time, or we were going to go with full Tommy John. So I woke up, and they told me that I had gotten the UCL Repair. So what had happened was my UCL was totally fine. It was just slightly torn off the bone on each side, and it was just enough to create enough laxity in the elbow that it would hurt. So then the rehab process starts for that, and started throwing probably 4 or 5 months after that surgery. And I had never had a surgery that was that difficult. I mean, recovery from that was really hard. So I had a lot of pain, which you do usually recovering from surgery, and I didn't realize until 10, 11, 12 months out from the surgery that it really hadn't fixed my problems. I was having some really weird symptoms with my forearm, which was like, it felt like the muscles just wouldn't turn on. It was very odd. So at this point, we didn't really know what's going on. And I certainly didn't know, because I'm not a doctor, And so I get in touch with a bunch of different doctors, try and figure things out. Again, I'm on my own at this point, so I can kind of go wherever I want. And got a bunch of different opinions. And one of the guys suggested, well, it's likely your ulnar nerve, because that symptom of the muscles not turning on was a pretty big symptom for them, a really telling symptom. And what had kept us, this took a long time to try and diagnose this, because what had kept us off the nerve in the past was the fact that I didn't have any numbness or any tingling. And that's usually the main sign with nerve problems. So what had actually happened, and we didn't know this until years later when we had figured it out, what had happened was I had grown so much scar tissue from the Ucl repair around the ulnar nerve that it was actually entrapping the ulnar nerve, and that's what was causing my problems. It was the scar tissue that was causing the problem. But the surgery we decided on is called an ulnar nerve transposition. And with mine specifically, they put it under my flexor muscle. So what they had to do, they opened me up, they cut the flexor muscle, they put the nerve under it, and then they put the muscle back on top and sewed it back to the bone. Now, the reason they do that is because it makes the path for the ulnar nerve shorter. And a lot of people have ulnar nerve problems because it has to go around the bone in the elbow. It kind of lengthens it and puts it in a pretty stressful position. So the idea was, let's make it as short as possible, the path for the ulnar nerve. But like you can already assume happened, I just grew the scar tissue around the nerve again. So we didn't know this was going to happen, obviously, otherwise we would have made a different decision. But I got that surgery. We're talking another year or so out from that surgery, and I'm still having problems. So I met up with another doctor, Dr. Destin Hill. He was with the D-backs at the time, now he's with the Braves. And we did a whole bunch of very not standard diagnostic things to try and figure out what was going on. And he was actually the first one to suggest that, it's probably the scar tissue around the ulnar nerve. And we did a few techniques that would try and get the scar tissue away from it, like they injected water right around my nerve. And that actually gave me some relief of the symptoms. So this helped us really pinpoint that, okay, this is the scar tissue around the nerve that's causing the problem. So the next step was I went back to the surgeon who did my Ucl repair, Dr. Dugas. And the reason being was because there was still a little bit of question of, is the Ucl good or not? Or is it just the nerve? Like, what's actually going on? We didn't quite have a full picture here yet. So Dr. Dugas went in and he cleaned out the scar tissue from what he could see on the nerve. And he was like, yep, your UCL is good to go. It's totally fine. The joint's totally fine. The flexor mass is totally fine. Your problem is definitely the ulnar nerve. Now, what I didn't know going into that procedure was that Dr. Dugas doesn't do the specific type of ulnar nerve transposition that I had. So he does ulnar nerve transpositions where the nerve is on top of the muscle. Mine was the nerve was under the muscle. So he wasn't able to see the entire path of the ulnar nerve, which was a problem because he could just clean out the scar tissue from around the nerve where he could see it, but he couldn't see it the whole way through. And I didn't know this until I woke up, which was a pretty frustrating and disappointing experience, as you can assume. But anyways, woke up, doctor said, look, I cleaned you made a lot of scar tissue. He said, I cleaned what I could around the ulnar nerve. There's still under the muscle that's probably gonna cause you issues. And if you can get back and get healthy throwing, great. And if not, you're gonna need to go see that surgeon that you had the ulnar nerve transposition done originally. And he can get under the nerve or under the muscle and clean out the scar tissue from the nerve. So went to try and throw again, obviously after rehab, and it was still hurting. So went back to the surgeon who did the ulnar nerve transposition originally, and we had some conversations. And he said, you know, Dean, I really think you should retire. He wasn't very confident at all in being able to get me healthy. After however many elbow surgeries I've had, when you start to add them up, the body doesn't respond as well. Nerves don't really like being messed around with that much. and he was not confident in being able to get me healthy. And again, this is one of the best surgeons in the world. So for him to tell me that I should retire, I mean, he's a nerve specialist. He's one of the top guys, and he said, "Yeah, you should retire." Yeah, that's a pretty big blow, you know. And at this point, why he told me I should retire, not only is it a really difficult surgery and the chance of success is low, but the chance of messing something up and like ruining my hand and the function of my hand is pretty high. So that's why he recommended don't do anything and just retire. But I wasn't really comfortable with retiring. I really want to play, and I really think I can. So I went ahead and started doing some Googling and looking around for maybe people who have had similar problems to me. Is there anybody out there who's had, you know, a UCL surgery and then grows a bunch of scar tissue, had both ulnar nerve problems, and then did they get through it, you know? And I actually found a guy, and I'm not going to tell you his name. He's a current big leaguer, and he gave me a whole bunch of very personal information when I finally got in touch with him, and I think it's really important to mention in the story, but I'll leave him nameless just for his own privacy. I found a few things on Google where I knew I needed to talk to this guy, like different procedures that he had. So I reached out to a few friends, ended up getting his number, and had a conversation with him. And he gave me a whole bunch of information, and he had very similar problems to me, and he actually got back healthy, which was awesome. And so he told me about a doctor named Dr. Steven Shin in LA, and he's the neurologist for the Dodgers. So what he does essentially works on nerves, hand and nerve specialist with problems just like me, obviously not as complicated, but called him, and he was very confident that he was the guy. So he actually asked me if I had gone and seen the guy in my area yet, who's the specialist, is one of the best nerve surgeons in the world, and that was actually the guy who told me to retire, which I thought was funny. But Dr. Shin was very confident that we could get in there and we could take a good shot at this, and there's a pretty good shot to get me healthy. So that's why we're heading out there. We're heading out to LA. I've got ulnar nerve transposition revision surgery here coming up in a few days. I'm pumped. We'll see how it goes. But I'm excited to take you guys, like I said before, through the whole process. So here's step one, which is like, what's the problem and what's the history? We're going to go ahead and have surgery, take you through. You'll be probably in the recovery room with me in surgery. We'll take you through rehab, all the ups and downs, the throwing program, my thoughts through the whole thing. Hope you guys enjoy this type of content. Have any questions, comments, anything at all, leave them below and I'll respond to them if they warrant a response. I appreciate you guys watching and hope you enjoy it.